I'd like to take this opportunity to introduce today's presenter. Susan Thompson is a Senior Account Manager with OraSure Technologies Risk Assessment and Substance Abuse Testing Division. She has over 25 years of experience in the drug testing industry and worked in several laboratories prior to coming to OraSure in 2003. Susan's primary role at OraSure is to provide education, training, and program implementation for oral fluid drug testing. She works with industry partners, TPAs, laboratories, and corporate accounts in both the workplace drug testing and forensic toxicology markets. Now, I will turn the presentation over to Susan.
Great, thanks so much, Josh, and thanks to everyone for joining us today. As we all know, we're still in the middle of this COVID-19 pandemic. We can't turn on the news or get on the internet without it becoming one of the most popular topics, if you will. As more businesses continue to reopen and some companies start to transition from remote to on-site workplaces, it's natural for people to feel concerned about encountering the coronavirus at work. Because of this concern, COVID safe practices for the workplace are probably here to stay, at least for the foreseeable future. Part of implementing safe practices can include COVID testing and vaccination. And these safe practices can also impact a company's existing drug and alcohol testing program. So with all that in mind, let's take a look, let's review today's agenda. We'll take a look at some of the various methods for testing for COVID-19. We'll talk a little bit about vaccinations and their impact on the workplace, including other options to help keep employees safe. And finally, we'll talk about drug testing programs and how COVID has impacted these programs. In addition, we'll look at some ideas for maintaining your drug testing program with safe collections. So let's take a little bit of a closer look at the different COVID-19 tests that are out there. So there's several types of tests, and we're not going to go into a lot of detail on them. Many of you have likely had one or more of these COVID tests at this point in the game. But before we leave this slide, I wanted to draw your attention to the graph on the right-hand side, which depicts analytes for the detection of COVID-19 exposure and infection. Viral RNA and antigen appear first, so you see that reflected in the green and the red bell curve right there. So they appear first, showing the active virus and current infection. And then antibodies, of course, appear later in the timeline there at the bottom, showing past exposure and infection. And I think it's worth mentioning more than once during this presentation throughout our talk today that we're learning more about coronavirus every day. So it seems like each day that we look at the news, there's a different piece of information or fact that's been discovered. So let's drill down into these three types of testing just a little bit more. The first one that we'll talk about is PCR testing. So you've probably heard of that by now. It's what we generally refer to as molecular testing. So you'll hear those two terms interchanged often. It's typically performed in a lab, but there are some tests that do point of care. And what it does is it detects viral genetic material. In this case, it's RNA. PCR is considered the gold standard of COVID testing. And generally, it's the most sensitive of the COVID tests. And you can see the different types of samples that can be used for a PCR test. Before we leave this slide, I just wanted to touch on that word sensitive. You'll hear the terms sensitivity and specificity when describing these tests. And sometimes people mistakenly will use them as the same thing, and they're actually not. So it's kind of important to know this. Sensitivity refers to the ability of a test to correctly identify patients with a disease. So how sensitive is it? Can it pick up a true positive? And specificity refers to the ability of a test to correctly identify people without a disease. So a true negative. So that's really, really important. They're both equally vital in diagnosing. If you go to the doctor, you're sick, not only are they going to try to rule in ideas or diagnosis, but they're also going to rule out things as well. So I just thought it was worth a second to just talk about that and the differences. The second type of test that's out there is an antigen test. And this looks more at the protein. These can be conducted at a lab or point of care as well. I don't like that word reliable, less reliable, that's in that third bullet point. They're just a little bit less sensitive than your traditional lab PCR test, but they're definitely highly effective. They're fast, and they're actually pretty specific. So in other words, they're good at ruling things out. And again, these can be done with different types of samples. There's a lot of options out there. And then the last type of test that we'll talk about is an antibody test. So we're all, I'm sure, familiar with what antibodies are at this point. Antibodies are proteins that our immune system makes to fight infections like viruses, and they help ward off future occurrences of that same infection, And they can take some weeks, some days or weeks to develop. They are important in COVID testing so that we know if someone has been exposed to the virus. As we know, some people test positive for the virus and they are asymptomatic. They don't have any symptoms. And as we know, they can still pass along the virus. So antibody testing definitely has a place in the big COVID picture. A bit of additional information on testing, just a couple of bullet points we'll talk about here. So at-home collection tests, they're tests that will give you an instant result at home. Many of you may have purchased these in a drugstore over-the-counter situation so that you'll get an instant test there in the privacy of your home, or instant result, excuse me. And then some of the tests, they're at-home collections, but you send that sample into a laboratory for processing. So there are a few different options there with the at-home collection tests. Saliva tests are important to remember. Those tend to be samples that are a little bit easier to collect at home or actually even in a doctor's office. For any of you that have had a nasopharyngeal swab, those are a little unpleasant to do. And so saliva tests are a good option if those are available to you either at home or with your healthcare provider. And then finally, combination tests are popular right now. So a combination test does just that. It looks for flu and coronavirus. As you probably know, those symptoms can often be the same. They can be similar, the symptoms for flu and coronavirus. So, and especially as we go into flu season here, we're about to get into the fall months. Sometimes these are referred to as multiplex tests. So again, those are going to have their place in the overall picture, testing picture as well. So let's talk a little bit about vaccines and returning to work. So I know this is on everyone's mind. Here is the burning question. Can employers require employees to get a COVID-19 vaccine? And the answer to that is generally yes. It's a really valid question for employers. You know, are these mandates legal? Oftentimes, if you ask an attorney, they'll answer, gosh, that's complicated, or it depends. And those are fair answers. Recently, we've seen that such mandates can be lawfully put into place, these vaccine mandates. So an example is federal workers are now required to show proof of vaccination under the new guidelines that were announced by President Biden last month, so late last month. And if they don't have proof of vaccination, they're going to have to follow some strict rules on mandatory masking, weekly testing, and social distancing. So you're going to hear those three terms used a lot: the mandatory masking, weekly testing, and social distancing. We've heard those terms a lot this past year, and they're still really good common sense tactics. In addition to the federal workers, the military said, military is part of the federal workers, the military said it would follow suit with its employees as well. Another major employer that's come to light recently in the last couple of days is Tyson. So Tyson, food manufacturer, meat packing plants, they have mandated now that all their employees, including their frontline and manufacturing workers, in addition to their corporate employees, be vaccinated by November. So that's important, pretty big employer, and they're making sure that everybody comes under those mandates. I think there's different deadlines depending on the type of worker, but pretty big announcement from them. They're definitely taking a stand on this. So honestly, any company is typically within its legal rights to require employees to get vaccinated, barring any conflicting disability or religious belief, and this is according to the EEOC. We always recommend get guidance from in-house counsel, and AccuSource can also assist you with some of these questions. Generally speaking, not always, I'm not an attorney, but generally speaking, state laws, there are federal laws and state laws obviously, but state laws tend to impact our day-to-day situations and workplaces more than federal. I mean, that's not always the case, obviously, so I don't want to make an overgeneralization, but a lot of times state laws, federal laws will refer you back to the state laws. Here are some examples of states that have started some legislation, but maybe not quite there yet. So, and this is actually, our consultant actually just emailed me a couple of hours ago with just the most updated information here. So this is pretty current. So Pennsylvania had introduced a bill earlier this year about vaccination, and this is still in progress. It's currently in the Rules Committee there with the state. New York introduced a bill late last year, and it actually morphed into another bill, which I guess these things are often happens with them. So again, nothing's happened yet, but there are multiple bills in progress there in the state of New York. Interestingly enough, as many of you read, New York City recently mandated proof of vaccination to enter restaurants and gyms and other businesses. So that's going to be kind of interesting to see how the state of New York and New York City balance these things out. South Carolina is in a similar boat in terms of a bill has been introduced, but still in progress regarding vaccination. Similar bills were introduced in Washington and Minnesota. I believe those bills have not gone anywhere. They may have died in session, or there's another term for that, I'm sure, but I'm not 100% positive on that. But I know that they were introduced. So again, comes down to a lot of times state law kind of dominating our day-to-day situations. These are the exemptions that I touched upon just a couple of slides ago, and they're important to mention. So and these are tricky. So again, we always recommend consulting AccuSource and in-house counsel too. So an employer can sort of, try to override some of the employees that do not want to get vaccinated, and that's not the correct term, I'm sure, but it's very tricky with ADA and Title VII standards. So if the vaccination, the EEOC defines if vaccinating or not vaccinating an employee, excuse me, with a disability or a religious belief happens, the employer needs to define if that's a direct threat or that unvaccinated employee is going to be, there's a significant risk of substantial harm to other employees. So some of the things that they're going to look at for these direct threats, so to speak, the duration of the risk. Is this employee, how long will they be exposed to other employees if they're not vaccinated? Can we define that potential harm and the likelihood? Will it occur? Will it not? So I'm thinking of Tyson right now, all of those folks in the meatpacking plant that are working very, very closely together, side by side. I think I might want to be next to somebody that was vaccinated. Obviously, everybody has a right to get a vaccine or not, but that's an example of something that might come up. So again, consult in-house counsel on this, and also AccuSource can assist you with more information on this. So now that we've talked about testing and vaccines, let's talk a little bit more about details. How can you continue to keep your staff safe as you return them to the workplace? So this slide is pretty, I was gonna say it's pretty black and white, but it's pretty navy blue and white, if you will. On the left-hand side, when can you do some testing in there? And this is not vaccination, it's just testing. When it's a direct threat to the safety of others. And again, we go back to that example of people working in close proximity to other folks. Temperature checks are still relevant. They've sort of died down a little bit, but I think with the Delta variant continuing to be a factor, and there could be other variants that develop after this, we just don't know. Temperature checks will continue to be relevant. And then also asking about COVID signs and symptoms with your employees. It's not permitted for employees that might not be a direct threat or could impact the safety of others. So a good example of that are people that work from home. So your home offices, people that maybe are in an office by themselves. Those situations, the definition of the risk or the threat is a lot less than it is with people that are next to each other. And antibody tests are not required by EEOC because, as we know, an antibody test is not going to identify somebody with an active current infection. An antibody test is going to identify somebody that has either had COVID in the past or has been exposed to it. So here's just some quick best practices just to sort of review it. As we've mentioned, always stay current with your particular state laws. They can change. And I also mentioned many of you have employees in multiple states. So as you know, always good to stay current on laws in each of the states where your employees are. The second bullet point, it seems pretty self-explanatory, but you always want to make sure that your vaccines are administered by professional healthcare providers. So I can't imagine any of us just going somewhere and getting a vaccine administered by just someone that doesn't have that experience, but it's worth mentioning. Take a look at, again, exemptions for medical reasons and religious beliefs, and ADA also factors into that. So there may be exemptions that occur, and then there may be ways that you can get around that. Other things to consider when you're talking about vaccination is how will it impact your corporate culture? So you know your company's individual corporate culture, everyone's different, and how will this possibly impact that? How will it impact possibly employee turnover? Could that be a factor? Does it factor into the cost of hiring or terminating or recruiting employees. Does that factor in? Something to consider. And then the L word, litigation. Is there possibility for litigation for this? So those are all things to think about when you're considering vaccination. And then finally, I think, again, common sense, always focus on the safety that you're trying to establish in your workplace through the testing, even while the vaccination rates improve. So there's a lot of talk about this in the news. We've all heard this term, herd immunity, at this point. And so we want to make sure that enough people, the theory is enough people get vaccinated or they're exposed to the virus so that we prevent the continued spread of the virus. That statistic, I think, is still pretty current. 75, they're estimating that 75 to 80% of the population needs to be vaccinated in order to get that herd immunity, that protection. And again, these facts, we're learning more every day. So these statistics can certainly change. This statistic's important. About 40% of Americans are not yet willing to get a vaccine. And that, again, that's their right. People need to make that decision for themselves, whether they're going to get vaccinated or not. And there's so many different reasons that people choose not to get vaccinated. I read an article about it this morning. There are just some interesting takes on it. So it just really depends on that individual, and they have to make that decision for themselves. And then you can implement strategies to work with that if you need to. As we all know, these vaccines, as we've heard, they're not, an instant solution. People that are vaccinated can still get sick, can still get COVID. It doesn't happen very often, but it does happen, especially with this Delta variant. And we all know that if you do get vaccinated and you do get sick, your sickness you'll be less severe, and there's less likelihood of you having to be hospitalized. So those are really good points. They're not insignificant pieces of information. If you're going to get sick, you're going to get less sick. So that's good to know. And finally, before we leave COVID and move on to drug testing, here are just some considerations, some additional considerations for HR. If you're going to test, decide on the frequency. Is it weekly? Is it more frequent than that? What type of test are you going to administer? That's important to know as well. Are you going to do an instant test, and also are you going to do one that goes to a lab? Will it be a PCR? Will it be an antigen test? So those are things to think about. You need to provide testing for both your symptomatic and asymptomatic employees. So that's important. I know the word consistency comes up a lot in HR and drug testing, so you want to make sure that the rules apply evenly. Another option people consider is making testing available for your family members of your employees, which makes sense. You're going home to your family and you want to make sure they're not exposing you unnecessarily. If somebody is sick or exposed, determine those quarantine guidelines. And also, gosh, if somebody is sick, they feel sick, make sure that they know to stay at home. Again, common sense things, but they're worth mentioning again. If you have employees that travel, make sure that you establish travel guidelines. Some companies have completely curtailed all business travel, and some are slowly reintroducing it or changing who travels and who doesn't. So that's something to think about. And then last, adjust your guidelines appropriately for your essential versus your non-essential workers. So that makes sense. And then there's a website down there on OSHA if you wanted more information. So let's move into drug and alcohol testing during COVID. Talk a little bit more about this. I think it's important to note that now is not the time to consider suspending a drug and alcohol testing program. it may be actually time to recommit to that testing program. Not surprisingly to anyone, substance abuse is on the rise during the pandemic. Makes a lot of sense. We understand where that comes from. These statistics are pretty powerful. 13% of Americans are starting to reported they're increasing or starting substance abuse situations or habits, if you will, during the pandemic. Overdoses have definitely spiked during the pandemic. An interesting statistic, so back in 2018, opioid overdose deaths declined by about almost 5%. So in 2018, they were going down, and that was a hopeful sign that maybe we were finally emerging from our opioid misuse pandemic. But unfortunately, that decline didn't last long. In 2020, overdose deaths went up to a record 93,000. So that's a 29% increase from the previous year. So again, that's opiates. And not surprisingly, fentanyl was involved in more than 60% of these overdose deaths. So definitely something to keep in mind. Alcohol also, obviously it's a drug, and this also, alcohol use on the job has increased. So these are some interesting statistics that you can read, but no surprise, basically the sale of alcohol has definitely gone up. So no big surprise there. The online sales obviously far outpacing the in-store sales. So you can't go to a store to get your alcohol. Go ahead and have it delivered to your front door. Many states do allow that. So definitely on the rise. I think the last bullet point, overall consumption up 14%. So that's a pretty significant number. So again, your drug testing program can and should continue. Some people do get concerned about collection sites and possible COVID exposure at collection sites. So we're going to talk about some alternatives there in the event that that's a concern. And I know some collection sites, especially like those people that are DOT regulated, this has been a big concern this past year. Some of these collection sites have closed or their hours have been curtailed. And so for those of you that have regulated employees, you're may have had a little bit of a problem getting a collection done. And I know that's been a little bit frustrating for people. So that's definitely been a factor. So there are definitely some options to consider. Not all of them are available to regulated employers, but we'll talk about these as well. So let's talk about just quickly some legal considerations. Always important to remember with drug testing, especially when we're talking about alcohol and drug testing. As many of you know, alcohol pre-employment tests are not done. I think back when Omnibus came out and the original DOT regs were published, they had pre-employment alcohol testing, but they quickly got rid of that because they realized it just wasn't a productive use of time or money for anyone. So pre-employment alcohol screens definitely can't be done. They're protected under ADA. So, and they consider that to be a medical exam. So not pre-employment alcohol screens, which most of us know. But pre-employment drug testing, on the other hand, not restricted by ADA because illicit drugs are not protected under federal law. And then we just talked about DOT there. So those of you, again, that have DOT employees, you know these laws like the back of your hand and what you can and cannot do. Rapid testing is also it's being introduced to people, some people for the first time. There are some really good rapid instant tests on the market now. So the technology on them has definitely improved over these past years. Again, really good quality tests. You always want to make sure that if you're doing rapid testing, regardless of the sample type, that number one, rapid testing is permitted in your state And number two, some of them do have restrictions on the type of sample that can be collected with a rapid test, whether it's urine or oral fluid. Also, make sure if you're going to use an instant or rapid test, make sure that you're using one that has received FDA clearance. So that's really, really important to use an FDA cleared product in your employment drug testing program, regardless of which one you choose. And again, really good options out there. So these can be used on site. You can train your employees how to do these collections, or mobile collection services can also do these, or you can, some of your collection sites that you go to, if you want to do that, can administer an instant result. And remember, with instant testing, these are screening tests. So if that initial first result is what we call, sometimes it's referred to as a presumptive positive or a non-negative, there are different terms of using it, but basically it's positive on that initial test, you need to make sure that a second confirmation test is done. Sometimes these kits can be packaged up. So the original sample that's collected, if it's positive, you can package that up with chain of custody and security seals and send that original sample to a laboratory for processing for the confirmatory testing. And then sometimes you have to collect a second sample, but always make sure that if you do have a presumptive positive, that you're following that up with a lab confirmation test. So just to sum this up, these bullet points all basically say the same thing. I think, drug testing is still legal. So you'll hear, different stories sometimes, well, it's not legal here and it's not legal there. It's still legal everywhere. There may be a few laws that have been passed by individual states that put some particular mandates on the type of testing that they allow. So those are definitely out there, but you can still test for it in all 50 states, especially marijuana. So you can still do drug testing for marijuana, and you can still pre-employment test. And that's really, really important now. Also, in all 50 states, we know this last bullet point, but it's worth repeating. All 50 states, we want to make sure that we understand employees that abuse drugs and alcohol are more, or if they're under the influence, let's say when they're working, let's put it that way, they're the ones that are more likely to cause a workplace accident. They're more likely to file workers' comp claims. They're more likely to use or maybe misuse or overuse their benefits, and overall are generally less productive than their non-drug abusing coworkers. So a little common sense and no surprise there. So what we're finally going to talk about today is telehealth. And what is telehealth and how does that work with drug test collections? So telehealth has actually been around for a number of years, and many of you have likely undergone a telehealth visit in a healthcare setting or even a drug test setting. Telehealth is not fancy. It just means any sort of telecommunications that's done for in public health or education or a medical visit. Maybe you've had a telephone conference with your doctor, discuss lab results, or just to have a visit over the phone. That's a telehealth collection or discussion, if you will. So these have definitely increased this past year. You can see the last bullet point, there's 154% increase in telehealth visits to doctors. So definitely on the rise, and they can be done. They don't need to be anything fancy. As I mentioned, it could be as simple as a phone call or any type of video conferencing system. So it doesn't need to have a special program. It can be as simple as a Zoom call, a FaceTime call, WebEx, any of those types of things. I know a collector that does them on his iPhone. So there are really a lot of options with these. So this particular slide, I know all of these samples are X'd out, and it doesn't mean that they cannot be used in a telehealth collection. So I just want to make that very, very clear. You can use any of these samples technically in any type of telehealth collection. However, In terms of observing a collection, probably not ideal to be observing somebody on a video conference with a urine collection, a hair collection. If it's the donor self-collecting, and we'll talk about that in a second, that's going to be a little bit challenging as it is to administer a breath test on yourself. It's probably not really likely to happen. So oral fluid definitely lends itself to a telehealth collection. It lends itself quite well, whether it's observed or whether the donor does it themselves and it's observed, or there is a collector involved. So when can you use a telehealth collection? Pretty much anytime. It's virtually any situation can lend itself to a telehealth collection. So these can be done in situations where you have remote employees, perhaps the collection site is not an option and maybe you have a safety concern about putting that person on site. You can do it for really any type of testing purpose. I guess the only situation probably not is if you, or situations, excuse me, if there's an accident. Obviously, if it's post-accident or incident, they're going to need to be at a clinic. And also reasonable suspicion. That's probably a situation where you're going to need a collector there or somebody, as you know, to be the witness to the reasonable suspicion situation. So, but for pretty much any other type of situation, they're a really good tool to use, and they will overall reduce the time of collection and scheduling. So how does this process work? It's really simple. So if you're going to do it remotely with an observation, you need to make sure that your donor has the kit. So you need to mail that kit out to them and instructions on how to use the kit. That includes not only the collection device, so whatever you're using, but also the if the device, when the device gets mailed back in, make sure that they have all of the shipping materials, the specimen bag, chain of custody, and the shipping envelope that it's going to go into. Make sure they know how to use the video conference or the app. There are some great companies out there that offer a special app for telehealth collections. They work really well. So that may be an option as well, but make sure that they understand how to use that and they have instructions. As with any drug test collection, you need to make sure that they've got their valid photo ID so that that's going to be visible to the collector on the screen. They begin the test, open the device. Again, this is all under observation. They follow the step-by-step instructions either from the collector or on the app. So again, the apps can walk people through these instructions. And then they mail that sample back into the testing facility. So pretty easy there. Collection sites can also do telehealth, so that's an option as well. And these can be administered by a professional collector. AccuSource can also manage these collections for you, the telehealth options. So they're definitely a good resource to contact about your options there. Again, web conference apps will do these very simply. So any app will do, doesn't need to be, or platform will do, doesn't need to be anything special or fancy. And make sure if you're doing a collection site telehealth that your collection site has all of these supplies. They likely do, but just in case, you just want to make sure that they have them if they're the ones that are doing them. The TPA or the collector can lead the donor through this collection process. And then, of course, this device is mailed into the laboratory for processing. So the TPA, AccuSource can definitely assist you with all of this. Let's talk about telehealth collections and cheating. So since they're observed, probably the likelihood of cheating not significant. As I say that, we all know if there's a will, there's a way, and if somebody wants to cheat on a drug test, they're going to find a way. We all know that at this point in our careers. So, but for the most part, this is a great observed collection, that is pretty difficult to cheat on or adulterate, especially if it's oral fluid. Something I'll mention right here, this bullet point on 2019 positivity rates. So we're all probably, I'm sure, familiar with the Quest DTI, the drug testing index that comes out every year. It has some great, fantastic data on drug testing. So we actually have the 2020 updated version. I apologize, it did not make it onto the slide. But the latest data for that in 2020, oral fluid had a positive rate, of 13.6%. So it definitely went up. Overall positivity rate of oral fluid samples was 13.6% compared to urine samples, which were about 4.4%. Again, these are the 2020 statistics. So I don't know if that tells us, it tells us that, yeah, oral fluid is good at picking up positive drug tests, but people can likely cheat a urine test a little bit easier than they can cheat on an oral fluid test. So that might be one of the explanations for the positivity rate. It's, again, really very difficult to adulterate an oral fluid sample because of the observable nature of that collection. It's real hard to do that. And finally today, let's talk about adding telehealth to your collection workflow. So if you're interested in doing this, what can you do? As with any change to your drug testing program, you want to make sure your policy is updated to include this telehealth option. So as you know, you just want to be really specific on what you're adding, how you're adding it, how it will work. Again, like with any update that you make to your drug testing program. Reviewing your company policy. For those of you that have unions, you want to make sure, I don't have to tell you this, collective bargaining will likely be a factor in this. So you just want to be able to take a look at that as well. As again, as with any change, you always want to make sure your employees know about any policy changes. So pretty self-explanatory there and pretty basic rules on that. And then make sure that your policies are updated on exactly how and where and when these telehealth collections are going to occur. Again, I refer you back to AccuSource that can provide you with assistance on policy updating. And we'll just take a look finally at this slide. It's our final slide today before we go into Q&A. Telehealth and legal considerations. So it is still relatively new. Again, it's gained in popularity this past year with the pandemic and people not really going to healthcare providers and clinics to get things done. Currently, there are no state laws that prohibit telehealth collections, though there may be statutes that limit how they can be performed or what type of specimens can be used. And that's pretty much par for the course with any type of drug test collection. And you know what, we're still a little bit early in the telehealth world in terms of drug testing, so we never know if that law is going to change. But AccuSource can definitely keep you posted on that. As you probably surmised, they're not yet permitted with the DOT collections, so that may change, but right now they're not permitted. And then again, as I mentioned, you always want to make sure that all the state laws and federal programs are carefully reviewed before you implement a telehealth program. So with that, we're right about at that 45-minute period. And I believe Josh is going to come back and assist us with Q&A.
Thank you so much, Susan. We will now dedicate the remainder of the webinar to addressing attendee questions. If you have not had a chance to ask a question via our chat box, please feel free to do so now.
Thanks, Josh. Susan, the first question that we have is, how do we handle employees who will not get vaccinated? What are my rights as an employer?
So good question. If someone, again, as I mentioned, if someone does not want to get vaccinated, that's certainly their right. So you have to do some accommodations for them. If they are not getting vaccinated because of an ADA situation or religious belief, then you need to get more details from them on that and accommodate them. I would also say, make sure, again, follow those common sense guidelines. If you have to enforce mandatory masking, testing, so maybe they get tested weekly or twice a week, but you can implement that. And then the social distancing as well. So if they don't want to get vaccinated, let's make sure that we're maintaining that 6 feet of distance.
The next question that we had was, should we conduct a return to work drug test on employees re-entering workplace from our layoff or furlough?
Yes. So that's also a good question. It's just as if you're I don't want to say rehiring the person, but that's in essence what it is. You're bringing them back on board into your workplace. So yeah, you're definitely within your rights to implement that quote unquote pre-employment test to get them back in. I would also take a look at your policy. You may already have some language in your corporate drug testing policy on reinstating employees that are coming from a layoff or furlough. It didn't have anything to do with the pandemic, but yeah, it just makes good sense to treat it like they're coming in again from a pre-employment standpoint.
Perfect. The next question that we had is, what would be a good criteria for deciding to open the office or not regarding the Delta variant? We were planning to reopen in September, but now reconsidering.
Wow, that's a very good question. And I would consider the Delta variant just like anything with COVID. Yeah, Delta variant is more contagious, and it seems to be making people sick that necessarily wouldn't have gotten sick. But if you're maintaining all of those guidelines that we've talked about, so masking and social distancing, those are good things to keep in place. You may, as an employer, decide, gosh, you know what, the risk has become too great at this point, and maybe we will wait a little bit before we reopen. So that's certainly your call as well. But if you do decide to reopen, again, just make sure that you're following those good guidelines about masking, social distancing, and testing regularly.
The next question that we had is, can our company conduct COVID testing on site in the workplace? Are there any restrictions or rules on doing this?
So there are a few rules on this. If it's a product that is approved for point of care or instant over-the-counter testing, if you will. So let's say it's similar to a product that you could go into Walgreens or CVS and buy over the counter. If it has that type of approval, then there's not going to be any restriction on you administering this test in the workplace. So that can be done, no problem. If it's a test that is labeled differently, so an example of that would be something that's labeled for professional use only, and that means the test is labeled and packaged to be specifically administered in a healthcare setting by a healthcare professional, then unless you have that type of situation at your workplace, that is not a test you can do in the workplace. So the exception of that would be a lot of big companies have on-site occupational health facilities. And these occupational health facilities may even be doing some instant testing there, some of the bigger ones. So they may have special licensure to do that. So if you are working in a situation where you have that type of on-site health facility and they have those licenses and they'll know, then yes, you can use these professional versions in the workplace. And then there's also some tests that are labeled home use, but with a prescription. So these are tests that are authorized for home use or by the consumer, but they have to have a prescription from a healthcare provider. So those situations, you can use those tests in those scenarios as well. You just have to make sure that you have a healthcare provider doing the prescription for it. If you don't have access to that, there are companies that actually can arrange for these prescriptions for you. So they just have a service where they offer that actual prescription service from the physician for this on-site product.
The next question that we had is, I may be interested in implementing telehealth collections. Where can I get more information or assistance on how to set this up?
So I would refer you to AccuSource. AccuSource does telehealth coordinates these for their customers right now. So they can walk you through all of the elements for this. So they can walk you through how to add this to your policy, what specific language you need to put in your policy to incorporate telehealth collections, and how to arrange them for you. So in other words, walk you through the different platform options. I know we talked about doing it Zoom, or doing it FaceTime, or doing it WebEx, or doing it on the phone, or via an app. There are a lot of different options. So if you're interested in getting this set up, just contact your AccuSource rep, and they're going to be able to assist you with implementing that.
Thanks, Susan. Susan, this is going to be our last final question. If you entered a question into the chat box and we didn't have an opportunity to address it live, our team will follow up with you directly post-webinar to provide you with an answer. So the last question that we have, Susan, is should employers test for marijuana in recreational use states? Are we getting any closer to THC tests that objectively indicates impairment?
So that's a good question. They're all good questions. So I'll answer the last part first. Are we getting any closer to a test that will determine THC impairment from THC? And the answer is no. We're not there yet. I think sometimes I hear from people, oh my gosh, there's this test so-and-so has that will show impairment. And I always ask a few more questions about it, because the fact is we don't have the science yet to determine an impairment level from THC. It's simply just not there yet. They're working on it, but it's not there yet. It's not like alcohol. THC is a completely different substance than alcohol. We are able to determine that legal level of impairment from a level, but with THC, it depends. It just impacts individuals so differently, and one person may consume this amount and be impaired, and another person could consume the same amount and not be impaired. So that's the short answer to that question, is there's not a level or not a test yet to determine impairment from THC. But of course, stay tuned. We don't know when that will come out. You can always determine a quantitative level. So that's sometimes where people get confused. They said, well, gosh, they said it's 5 nanograms or 10 nanograms or 50 nanograms. That's true. You can determine the actual level of THC in the sample if it's present, but that doesn't necessarily indicate that the individual is impaired. So we're not there yet. And yes, absolutely. Employers, it's still legal to test for marijuana. I know that some employers have made a decision to remove it from their drug testing program. They just, for whatever reason, with their corporate culture, they've chosen to remove it. I just sort of liken it to alcohol. You know, you still test for alcohol, maybe not on a pre-employment situation, but you can test for alcohol in these other scenarios. Alcohol is legal, even if marijuana is legal. Same thing. You can come to work, you can use these drugs, but you can't come to work under the influence of these drugs, I guess is the key takeaway. So yeah, absolutely continue to test for marijuana. If somebody is impaired, even if it's legal in your state, you definitely don't want them working next to other people or in your workplace, period.
All right. Thank you so much, Susan, for facilitating this informative webinar. And special thanks to all of our attendees for joining us today. If you have any additional questions, please contact us at marketing@accusource-online.com. On behalf of AccuSource team and OraSure Technologies, we wish you all an enjoyable day.